I was all messed up. But it was good because I have no idea, and like at least me trying to be positive, I was thinking that I needed to have it on my knee, so I come and I finish aligning my whole spine so then I can be better at dancing and not have to worry about getting injured all the time. I had like injury in my knee and I couldn't dance for 3 months, so the brother of my boyfriend, he used to come here, so they told me to come here and see what should I do. I'll be able to dance today, which is great. And then my body, like even if I hate being cracked. Oh, today hurt less. It wasn't that terrible. It wasn't that terrible. I can feel that my neck needs it.
Potato?
Yes, I put a potato and I know it's fun.
I haven't heard that. I've heard ice, I've heard mud. Put some mud on it.
I
like
put that
cold
and it
mud.
was fine. I mean, it didn't hurt. It hurt like 5 minutes and then I was fine.
Sweet potato?
No potato.
No potato.
Yeah, I feel like before I tried so many times to dance and it kept hurting, now I'm afraid. Because I feel like if it's still hurting, I don't know what to do.
So definitely dance. If you feel a little pain, it's a little dull, achy, you'll be okay. Sharp pain is the body telling us to stop.
Okay.
IT band stands for iliotibial band. It attaches onto the hip here, but it goes all the way down into the knee. So it can also cause some knee pain too if it's not working appropriately.
There it does hurt a lot.
Keep breathing. What we're doing, we're pushing your muscle back onto the bone so we can get it to stick. And also the IT band comes down and attaches into that lateral portion of your knee, that outside portion. It starts to recruit other muscles to take its role. It compensates. So up a little bit higher. Different muscles, extension of the IT band. It's the tensor fascia lata.
That's a funny name.
Do you like that name, huh?
Yeah.
Kind of sounds like a coffee, huh?
Yeah.
What would you say is your favorite area to get muscle work done?
I don't know, everything's terrible. Everything hurts so much. But definitely the
one that you're face down working into your glute?
That was terrible.
That was pretty tender today.
And there hurts a lot too.
Yeah. Just remember, you're an infinite being. You're a spirit having a human experience. It's just temporary.
Oh my god, it hurts so much.
Keep breathing. Keep breathing. There you go. Perfect.
Oh my god.
Much better. So you're having some knee pain, left knee pain?
Yeah, like the first 2 classes. Oh my god. I couldn't finish. Like I finished it because I can't leave a class. I'm never gonna do it even if I'm bleeding. So I did it and I was out of the video, everything.
Yeah.
But then it was hurting so much. Like I was like finishing dancing, like screaming of the pain. And then the last class, it didn't hurt in the class. It hurt when I went to sleep.
It hurt afterwards?
Yeah, like I was fine and then I woke up in the middle of the night because it was hurting.
And the pain is all behind your knee, huh?
Yeah, like right there. Yeah.
The outside and behind.
Yeah, this thing.
Gotcha. So it's popliteus muscle, which is a muscle we've been working on, as well as the hamstrings.
Mm-hmm.
Hamstrings are holding today. We'll check your popliteus muscle. Keep breathing, big breath. Stay close. Relax there. Remember how we did your upper back the last time? Here.
Yeah.
Good. Breathe in. And out. Lift your head and upper back towards me. Right there. Woo!
Oh, that was terrible.
Good. Come on over this way. There we go. Well done. Just a little tension under the shoulders.
Oh my god.
We have neck muscles that go all the way down and attach to these first few ribs here. So I want to loosen these up before we adjust your neck. So help loosen up the neck too. There you go. Amazing. So you feel how this is a little stuck going this way?
Yeah.
When we go here, it moves.
Mm-hmm.
So that's right at the base of your skull. We have something called your atlas, which is your first cervical vertebra. It's where your skull sits on top of the rest of your spine. Then we have the occiput. So when we're moving and rotating your head, laterally bending, bringing the ear closer to the shoulder, it's more stuck on the right side. So I'm going to adjust the base of your skull so we can get more movement in there.
How you do that? Is it
You're gonna
painful?
come up. No, there's no pain that comes from this office. Let me help you up here. I mean, all the way back. Beautiful. So right in here. So we're adjusting this area. This area houses the brainstem. It has one of the most neurological poles, so a lot of information that goes into our brain right in through this area.
Okay.
So it helps promote something called parasympathetic, which is rest, digest, relax, heal, recover. So it's going to help with sleep. It's going to help your body be in a better state of healing as well. And that's the state we want to be in.
Yeah.
So I got you here. There you go. Perfect. So what I'm going to do, I'm going to bring your ear closer to your shoulder. We're going to rotate a little bit. Drop your head all the way down. Big breath in. All the way down. Good.
It wasn't that terrible. It wasn't that terrible. I thought it was gonna be I was so scared. Okay.
How did we do?
It hurt a little bit, but it's fine. Normal pain.
Quick and then it went away.
Yes.
But did you feel how well that moved?
Yeah, no, I felt it.
Yes.
Like I needed it. But I was afraid of.
I know. Sometimes it could be a little bit scary.
But it was good. It was good.
You did well.
Yeah.
You did great. That's all I want to do with you today. Feels good, huh?
Better than
You won yourself some traction now. You won yourself some traction.
Yay.
Hey, jump in with joy.